Hello, cruel world. My name is Dr. 𝐏𝐬𝐲𝐡 𝐅𝐸𝐬𝐲𝐝. I'm a consultant forensic psychiatrist and I live and work in London. So today's episode is going to be about corona-related psychosis. Now, I first heard about this on Twitter a couple of weeks ago. I did a bit of research and I don't mean to be alarmist, but I'm afraid to say it's a very real thing. I saw an article in the New York Times, which was very enlightening, which talks about cases. I'll put the link in the description below if you want to check it out yourself. So it seems it's legit, and what happens is there's a series of people in their 30s, 40s and 50s who had coronavirus, and then months later down the line they actually became psychotic, and don't worry, I'll explain what psychosis is later on in this video. So this article gave a case study of a particular woman who was middle-aged. She had 2 young kids, and really worryingly, she started having these thoughts, intrusive thoughts, hearing voices and seeing visions of her children dying, and she had thoughts of wanting to decapitate her own child. Now, obviously this is really alarming. As a forensic psychiatrist, I assess these kinds of cases, and actually recently, within the last few months, I've actually assessed a woman who literally did this, literally decapitated her own child. So I'm sorry to bring that up. I know it's a bit morbid, but it's just kind of, it's on my mind. I have to say that it's only a small proportion of people that get these kind of symptoms. So there was another study also mentioned within this article where they collated some information from 153 British patients, and about 10 of them had new onset psychosis. In terms of the mechanisms, it's thought to be due to the body's immune system, due to vascular changes, so that's changes in the blood flow and the blood vessels, and also due to the general inflammatory process. So let me tell you what I think about this. I'm not the kind of person that's easily shook, but I have to say even I am feeling a bit alarmed and a bit worried about what's to come. I think this could not have come at a worse time for psychiatric services, because we're already overwhelmed. The patient load is massive. Patients are getting worse because of isolation, social withdrawal. They have less access to medication, less access to mental health care professionals, less therapy, or therapy that has to be done via video link, which might not be quite as effective. And also the staff are struggling. So many staff are unwell. Some have to look after children, like myself, because the school lockdown. Some have to self-isolate. And also the ways that we're working in many areas have become more challenging. So just to give you an example, as a forensic psychiatrist, I have to do prison assessments quite regularly. So I'm being asked to do video call assessments to assess psychotic patients, and it's just nowhere near as effective as doing it in person. So just to be clear, I'm not complaining, because a lot of people, especially on the front line, healthcare work, have got it much worse than me. The doctors, the nurses that are dealing with acutely ill COVID patients, I think, have a much harder time. So I'm not complaining, I'm just saying that, I'm just giving you examples of how our workload and our work life is changing. What I fear is I already think that we've got a tidal wave of dung coming towards us, of anxiety and depression affecting so many people, and I think this COVID-related psychosis is just going to be another whole heap to go on top. I have to say, I've not seen any cases myself of COVID-related psychosis, but it could be that I see cases a lot further down the line, because they've usually gone through the criminal justice system, so I might see it later on. It would be liaison psychiatrists more likely to see these kinds of presentations, so they work within general medical hospitals. Another issue that I think is a bit worrying is the fact that the psychosis comes on months after the COVID, so the patients are not in a safe space in a hospital where it's easily diagnosed and treated. They've moved on with their lives, so the psychosis can kind of surprise them or come on at any point, which is worrying. I'm about to tell you what psychosis is, but before I do that, let me introduce myself. My name is Dr. 𝐏𝐬𝐲𝐡. I'm a consultant forensic psychiatrist, and I assess and rehabilitate mentally disordered offenders, and I do that in courts and in prisons and in secure psychiatric units. I'm also an expert witness, so I give advice to judges during criminal trials about mentally ill defendants. This channel is a psych for sore mind, so I address a whole range of mental health topics, some related to offending and some completely unrelated. My USP, I think, is that I talk about my real life cases for you, the dear viewer. There's something for everybody on this channel. Go check it out. So what is psychosis? Well, it's something I've mentioned many times in previous episodes, because it's a presentation that I see commonly. Psychosis is a temporary state of being out of touch of reality. It's not permanent, it's not ingrained, like for example, a personality disorder is. And it can last from anything from a few days, for example, drug-induced psychosis, to typically weeks or months. In some treatment-resistant cases, so cases that don't get better even with our best medications, it can last for years. In terms of specific symptoms, the most common ones are hallucinations, so like hearing voices, or delusions, like a fixed, unshakable false belief, like the belief that somebody is watching you, is following you, wants to hurt you. Those are typical paranoid delusions. Another symptom is disorganized thinking. That's when the connection of your thoughts are a bit jumbled. So the flow of your thoughts don't make sense. So you might be speaking, but you're constantly jumping between topics, so somebody else can't really follow your conversation. There's lots of factors. So it's not directly inherited, but there are genetic predispositions, meaning it runs in some families and not in most others. Also, acute stress can cause psychosis, as can illicit drug use, typically cannabis, amphetamines, and LSD. Also, there are some medical illnesses that are associated with psychosis. They include a brain tumor, multiple sclerosis, and viruses. So we already know that HIV can cause psychosis, and now it seems, unfortunately, coronavirus can too. I should mention schizophrenia. So schizophrenia is a tendency to have recurrent periods of psychosis. So just like one person having a seizure is just a seizure, if they have it repeatedly, then that's epilepsy. So in the same way, one episode of psychosis is just that, but the tendency to have them repeatedly, that's schizophrenia. So I've assessed and treated hundreds of patients with psychosis because I work in forensic psychiatry. So I work with patients that commit violence or come from prison, and that is a presentation they can lash out with agitation or due to their symptoms. So just to be clear, the vast majority of mentally ill people do not commit violence. In fact, they're more likely to be a victim of violence themselves. And the vast majority of people who do commit serious violence don't have a serious mental illness, but a small portion of them do, and that's exactly my patient group. In terms of how people with psychosis present to me, to the psychiatrist, it is very variable. People have different personalities, so obviously patients have different personalities. And also the way that their symptoms affect them is variable as well. So some people with psychosis might be paranoid, withdrawn, isolative, might not speak very much, might not come out of their room. Some people might have symptoms like voices that they just can't contain and they respond to, and they're agitated and they're confused. Some people have those same symptoms but manage to keep a lid on them. I have talked about individual cases quite a lot in my previous videos, so go check them out. So I hope this gave you a bit of insight, dear viewer, about what psychosis is and also what COVID-related psychosis is. I hate to be a scaremonger, but it's a real thing. So until next time, I'd be very grateful if you could please subscribe to my videos. That way you'll never miss out on a video. So on this channel, A Psych for Sore Minds, I release videos every Tuesday and every Friday. Generally, the Tuesday videos are kind of in-depth, they're quite long. I will usually talk about at least one or two of my own previous patients. Generally, the Friday videos, like this one, are briefer and they're kind of short overviews or summaries of a particular topic. Until next time, stay euthymic and remember, I love you.